I came to see Dr. Howe the first time when I was in the 5th grade, so about 10 years old. I was tumbling and I fractured my growth plate in my left foot. It eventually healed, but it still hurt really bad. And then I was diagnosed with CRPS, which is complex regional pain syndrome, a non-curable disorder that affects my nerve system. And I came to see Dr. Howe to help fix my brain signal so that my foot didn't hurt. I went to the doctor like right after the next day because it was swollen, and they put me in a boot and said like it was just a sprain. And then eventually I went to a different doctor and they said it was a hairline fracture. They put me in a cast. When I went back a month later to get the cast off, the fracture was still there, so they put me in another cast. Then when I got that last cast off a month later, my foot was swollen very big, and it was a different color and a different temperature than the other foot. But I went to physical therapy and I worked on getting my muscles to work back, for my foot to heal up.
We were unsuccessful with every treatment that we tried. So we made an appointment. We got here as soon as he would squeeze her in, and we literally, her foot was purple, very cold. She could barely walk on it. And within 15 minutes of our first visit, it turned back to a normal color and she could touch it. And it was just amazing. Mom, I don't know, I'm kind of feeling weird. And I was like, oh my gosh, what is happening? I thought, did I paralyze her? What have I done? And Dr. Howe walks back in and he said, touch your foot. And she said, no. And he said, touch your foot. And she said, no, I can't. It hurts too bad. And he said, touch your foot. And so she touched her foot. Thank goodness my camera was rolling, because she touched her foot and she kept touching her foot and she was dancing and she got up and stood on it for the first time. And I didn't know whether to cry, or I think I turned white from shock. And it was just, I'm getting goosebumps right now just talking about it, because it was the most amazing miracle that I saw in front of me. I've had a lot of people DM me, direct message me, text me. I have been willing to talk to anyone just to bring awareness to CRPS and let them know that there is another option, that they don't have to go through the traditional physical therapy that did not work for us.
To everybody out there that is like going through anything like this, like if nobody believes acupuncture actually works, you can trust me. I've been here, I'm still here. I came back from a terrible injury and I can walk again, and so it actually works.
Injured myself when I was caring for a patient that was very obese and confused and combative in hospice care, and I ended up tearing a ligament. And because I was trying to get back to my job and in the workman's comp world, I ended up having to stay in Western medicine, which meant following their doctor, who recommended an arthroscopy after a few months when my knee wasn't healing. And when I woke up from the anesthesia, I was in excruciating pain. I was told it would get me back to work in a few days, as opposed to adding pain, but I was told I needed to have a total knee replacement. And I woke up in even worse pain from that. And it wouldn't, from that point on, it wouldn't heal or lessen. From the time I injured my knee, I was on crutches, my friends here. And then after the total knee, I was in such excruciating pain that I started using a wheelchair. My world, getting out of pain, and he said nerve blocks in my knee until that didn't work, and then they would try a spinal stimulator in my back, which also can have potential risks, until that didn't work. And then I said, what then? And he said, well, eventually you'll be in a wheelchair on an intrathecal pump to help manage the pain as it takes over your body. And I knew I was just going to continue to be drugged and I would be treating the pain, not getting well. So I went to other specialists and talked to people in the medical world. Everyone was so sad, but they said, there's nothing, Sue, you can do. This is exactly right. This is all there is. I would be fully in a wheelchair on a morphine pump. And he said, well, your disease at this point has progressed enough, or syndrome. He said, your syndrome has progressed enough that it could be in 2 years you're in a wheelchair. When he said that to me, the first feeling I had was that I was run over by a truck. I thought my life is not what I thought it would be. So when I learned about Dr. Howe and the work he was doing with reversing things that are impossible in Western medicine, I called to make an appointment. And for the first time, I had someone that both gave me hope. I held hope in my heart, but he said, oh no, I can help you. And I have helped people with this syndrome before. With the first treatment, I began to feel less pain. And with each treatment, I began to feel less and less pain. And I had never gone down in pain, only up. And so my treatments were a gift in reversing the pain that was so acute. My nervous system was firing every 5 minutes. It felt like I was being electrocuted every 5 minutes, 24 hours a day. And I went from just that constant pain to tolerable. And the pain began to ease. And with time, I got out of my wheelchair and began to use my crutches again. And then with time, my pain got down to 0, and I was able to walk without crutches or being in a wheelchair. Saw Dr. Howe and started getting out of pain. Suddenly, I could re-enter my life again. I can be out of bed. I can cook a meal. I can enjoy my family. What I would love to offer to anyone who has complex regional pain syndrome and who is in Western medicine, where the toolbox is very limited in what they can do, is that it's important to open your mind and your heart to finding something else. And by research, I found Dr. Howe and Neuro-Acupuncture, which I didn't know anything about. And in Western world of medicine, it didn't make any sense to me that it would work. And yet it does. And I have met many patients while I've been here who have been completely reversed, coming in spastic in a wheelchair, shooting with pain, crying out, which I lived in that world of screaming at night, drugged, but I was just getting electrocuted all the time. And now I have my life back because I explored alternatives and found this neuroacupuncture that completely gave me my life back, and I believe it could give anyone else their life back too.
A couple months ago, or was it when Dr. Howe said, hey, you're set, you're healed, you know? I mean, it was like, wow, we were waiting for that day.
So after 5 years of living in bed, and when I needed mobility, using a wheelchair or my crutches to get around, I am completely healed by the neuroacupuncture I received, and I no longer need any of these assistance. I can walk by myself. So I'm giving these away and walking with ease.